Hello, it's Dr. Rhonda Johnson. Today is Wednesday, January 5th, 2022. And today I'm talking about COVID-19. Folks, it's not just a respiratory disease. Well, scientists and physicians have been well documenting the widespread organ involvement from COVID-19. But recently, a team of researchers from the prestigious National Institutes of Health published a scientific paper which showed some remarkable findings. They did autopsies on 44 patients with COVID-19 between April 2020 and March 2021. And their findings show that the SARS CoV-2 virus was widely distributed, even in patients who died with asymptomatic to mild COVID-19. And they found persistence of active COVID infection in the brain for 230 days, almost 8 months after infection. And in addition to the brain involvement, they found persistence of COVID infection in the heart and in the blood vessels and the lymph nodes and the spleen and the small and large intestines, colon and the liver, in the kidneys, in the thyroid gland, the adrenal gland and the pancreas, in muscle and peripheral nerves and body fat and skin, even in the tissues of the eyes and in the testicles and the uterus. These findings certainly confirm the existence of long COVID or post-COVID syndrome, that lingering state where recovery can be prolonged in some individuals post-COVID infection. Now, that is not to say that everyone who has COVID infection will develop persistent infection or multi-organ involvement. More study will be needed, folks, as the scientists learn more about this virus and its variants. However, it serves to remind all of us that although COVID may be transmitted as an airborne pathogen, it is a virus that travels through the blood vessels and possibly other body fluids, and it can attack many organs and our brains. We don't know what implications this has for Omicron because scientists are just studying and learning about how Omicron affects the body. Speaking of Omicron, the CDC now says that Omicron accounts for 95% of U.S. infections. We hit a record on Monday. Over 1 million people tested positive for COVID. So, folks, we need to do everything we can to prevent infection. The best COVID infection is the one that never happens. And the next 2 weeks are critical in terms of slowing the spread. Please use common sense as you go about your daily living. You may want to rethink about avoiding large gatherings or in-person social activities. That's my message today. Stay safe, use your mask, double up, and take care.